what we consume when we eat from processed foods, especially nowadays, causes some of that inflammaging, as you mentioned too, as well. The thing with this is that if people can cut down on these things and work on, that would also suffice too as well. If you decrease, you're less inflamed. And so that's why they're seeing these positive effects from things to cognition to a certain extent, to pain to a certain extent. Because it's quieting down that smoldering inflammations that should tell you about what our food chain is like, really, ultimately.
Hi, welcome to the Optimising Your Brilliance podcast, where we get to the source of what makes people brilliant and explore how to eradicate the barriers that stop you from shining. By shining, I mean being at your absolute best in both work and life. You'll hear from business and thought leaders who bear all and share their insider secrets, along with my episodes focused on optimising your performance, productivity, success and well-being. My name is Estelle Reid, founder of Be, executive coach, speaker and best-selling author of Inner Brilliance, Out to Shine, 10 Antidotes to Imposter Syndrome, Workaholism and Stress. So if you're ready to take your work life to the next level, let's begin. Welcome everybody. I have got a very special guest, Dr. Fawad Mian, all the way from New Jersey. It's so exciting to have a doctor on the show as well. I'm really excited to dive into what you do for a living, how you help people. First of all, to begin with, can you explain what a neurologist is? You've been a neurologist since 2009. What is a neurologist?
First, let me say thank you for having me on the show. I deeply appreciate it. A neurologist is one who deals with basically the brain and just disorders with the nervous system. So common things that we may deal with are, I'll just give you some examples, people who suffer through migraines, people who suffer through memory loss, dizziness, neck pain, back pain, muscle disorders, weakness. Also people with seizures too as well. These are some of the more common ones that we typically see in the office. And so we tend to always be one of those lines of defense in the medical system where the other doctors don't quite know what's going on, and so they feel the condition may be neurological, and so inevitably they're sent to us to try to help sort that out.
Wow. And so take, for example, my mum has had 3 strokes. How would a neurologist help someone like that? So it has affected, for example, sometimes her memory.
Yeah, so strokes can be very challenging because we see them more in the hospital setting, and then we see the follow-up outpatient. So it's really depending on what the mechanism is, whether or not it's a clot that's large or something that's small, or there's a propensity for the blood to be thicker. We try to figure out the mechanism of what happens. Ultimately, at the end of the day, we try to mitigate risk factors. So common risk factors are things like age, blood pressure, diabetes, being overweight, smoking, very common things. A lot of people will end up on a blood thinner of some sort, and there are various different medications for that, some stronger than others. If there's a propensity for blood clots that emanate from the heart, there are stronger blood thinners that can be utilized too as well. It's been shown in some research trials that high dose statins, so things like atorvastatin or pravastatin, for instance, can be utilized for stroke prevention. So many people tend to be on that, and we have certain goals for what we call the LDL particle size. There are parameters to help reduce that to a certain extent. Blood pressure is also a very big thing and often gets neglected. So making sure that blood pressure is optimized, because high blood pressure causes increased pressure on the walls, causes chronic damage, and makes the arteries less compliant. Smaller arteries, I say this in a colloquial way, get burnt out over time in the brain and other places. And so basically these are just increased risk factors for stroke. The other thing we might also check is if somebody has sleep apnea. Sleep apnea is a risk factor for stroke that often goes unnoticed. And we've had cases where that has only been the only risk factor. Sleep apnea does increase your risk of stroke and heart attack, amongst many other medical conditions, including memory issues too. So we often will evaluate for that too. And then it goes without saying, even though it's left unsaid, unfortunately, by a lot of doctors anyway, what you consume, how you deal with your stress, and exercise is also paramount too as well for keeping your body at bay in terms of decreased inflammation throughout your body and trying to work on your best self so that we can really mitigate any future strokes in the future with collectively doing these things.
Great. So I have heard a term recently, which is inflammaging. Is that something that you use in your profession? Can you expand and explain what inflammation does to our bodies and why
Yeah.
it's not a good thing?
Yeah, so first and foremost, it's something that I stumbled on years ago, a long time ago, by accident. And now I look at this and how I look at a lot of chronic diseases in general is just this chronic inflammaging, essentially. But a lot of people don't even know what that is. But the colloquial way of saying it is that there's this slow smoldering inflammation, the irritation of the body that's going on. And what happens with that, and this can be from a variety of different reasons. I'll just give you some examples. So I mentioned some of those chronic conditions like blood pressure, cholesterol, diabetes, poor diet, lack of exercise, poor sleep, and also toxins may be exposed. So these are common things that can just irritate the body. And that's not by any stretch of the imagination exhaustive of everything. But when you have this chronic condition going on, it affects everything in our body from our arteries to our organs, our muscles, and all of that. And so body's always on defense. Our immune system is on overdrive with all of this. And then inevitably, what this really says in English is that your body starts breaking down in every which way. And because of that, we you talk about inflammaging, where the body technically is aging faster and we're getting more chronic damage. And so we're more predisposed to having more negative chronic conditions ultimately at the end of the day. And that's quite unfortunate. We try to address those things by looking at different root causes for that in somebody. And we try to address that. And sometimes that can be quite hard and challenging in folks who are very resistant. But we definitely try to tackle those things.
And so, what might we experience if we were aging faster because of this inflammaging? What would be some of the clues to look out for?
Cognitively, you may feel that your brain is slowing down. It's harder to remember things. That's certainly one thing, and that's a common thing that we see. The other thing is pain. Everything hurts.
Yeah.
Everybody's don't get old. Everybody keeps saying that. Don't get old. Things start getting hurt, start hurting, start breaking down, or then people accept, hey, this is how it's supposed to be, so they just keep going with it. But I would say cognitive issues, I would say chronic pain, I would say things that were under control in the past are not under control, certain medical issues. For instance, when your body gets out of whack metabolically, people are trying to control their blood sugars, their blood pressure, their cholesterol, say, for instance, it gets harder and more resistant. And so you get what we call that metabolic syndrome, where your whole body's thrown out of whack, essentially. And then you start getting these things, and they're all kind of tied somewhat together to a certain extent. And it's the trifecta that we always see with a lot of people ultimately. The other thing is also people gaining weight, and it's hard to really lose the weight because they start developing a lot of the insulin resistance and metabolically their body's not running the way it's supposed to. So in men, for instance, that can get that central adiposity, or meaning that the colloquial term is beer gut for
Yeah.
people. They may be skinny, but that gut sure isn't. And it's something where there can be like deep visceral, there's visceral fat, subcutaneous fat, and without going too much in this, the visceral fat around the organs. We think that this is something that's inflammatory to the body, and they were trying to figure out ways to help reduce and reduce the reduction of this. But it's common to see that for a lot of women, maybe they may see that not only are they having cognitive issues, but again, they're really suffering through, hey, I can't seem to lose weight unless I go on one of the newer GLP-1 medications that are out there, and they try to work on that. And then it may not be sufficient even if there are other things that are going on, whether it's hormones or things they're consuming or other toxins or whatnot. So it's a very complicated thing ultimately or whatnot, but hopefully that gives like a little synopsis of things you can look out for.
And what's your view on that? What's it called? IP? Are we
GLP-1.
talking? Yeah, are we talking about Monjaro and all those other slimming injections? What's your view on those?
Initially, it wasn't very positive. Now it's, I think, more of a 50-50 thing for me. And the reason for this, it doesn't, what this medication does, it just slows down transit. It basically doesn't make you want to eat, essentially. It
Right.
slows down the transit of what's going on in your gut. So you you may feel nauseous. You don't want to eat. And I feel just what we consume when we eat, from processed foods to, especially nowadays, causes some of that inflammaging, as you mentioned too, as well. The thing with this is that if people can cut down on these things and work on that, would also suffice too as well. So anyway, the idea I'm getting to is that if you decrease eating, you're less inflamed. You're going to lose weight because you're just not taking in the calories ultimately. And so that's why they're seeing these positive effects, from things to cognition to a certain extent, to pain to a certain extent. Because it's quieting down that smoldering inflammations that should tell you about what our food chain is like, really, ultimately.
Yeah.
And so it's being hailed at different things. But I think the negative part about that is that for those folks who are not doing anything actively to fix their lifestyle, that is the big problem. So if you're not exercising, you're not working out, you're not working on your diet, you're not working on your mindset, and any of that, if you're just taking this medication to slap the band-aid on the problem, and if you're in the US, you wait till the insurance stops paying for it, that's how things that's how things run over here. Then you're going to go back to where you were.
Yes.
And I don't really see the point of that. The point is to change your life ultimately, because a lot of people will be like, I will just take this for a few months, then I'll see what happens thing. But then they never change what they do. And so it's hard to see that improvement if they're just not doing anything. I've seen patients who have done that. It's the same exact thing. They're like, okay, I'm not going to take responsibility for myself. And hey, my insurance changed. There are new benefits. They're not going to pay for it. It costs too much out of pocket. Lo and behold, you went right back to where you were. And so it's tough with that. And that's where I'm at with that. The other thing is also, I think, I keep seeing more like in social media, but this is something I'd seen earlier prior to that. But you're going to lose weight, but you'll also lose muscle mass, right? And so when you lose muscle mass, muscle is also very metabolically active in your body. Can even help with blood sugar regulation, amongst anything else. And as you're getting older, you're losing muscle for every decade of life. And then with this, if you're doing nothing, you're not building muscle and you're just taking all of the stuff, you're accelerating that much faster, really, at that point. And then there's increased fatty deposition within the muscles. And so metabolically, it's a little bit of a mess. So we call it quote unquote skinny fat. You may be a little bit skinnier, but your muscles aren't super healthy. And metabolically, you may be a bit of a mess afterwards or whatnot. So it's really important to have the adequate protein intake and also to build muscle. It doesn't mean that you have to work out like Arnold Schwarzenegger. It means that you're lifting some weights and you're building muscle, you're maintaining it.
And I was chatting to my husband just the other day. I'm a woman of a certain age.
Mhm.
I'm perimenopausal. I have gained weight around my middle. I'm not as slim as I used to be, but I walk up the fell most days. So
Mhm.
it's a really strenuous walk. It makes me out of breath. I monitor my VO2 max on my phone, and it was interesting to see how quickly that declined if I skipped it for a week.
Mhm.
But also, so when we were walking up the fell the other day, I said to my husband, I said, is this classed as a load bearing activity? Because I know that's important as well, isn't it? I don't know, you're the expert. So,
What you're doing, the cardio is great. If people are doing cardio, they're walking, you're going up hills, you're going down the hills, you're taking the time doing that, by all means, continue doing that. I don't think there's anything wrong with that. That's going to just help your body metabolically over time anyway. And it's not super, even though there may be some level of being strenuous, it's not exhausting your body to the point where it actually can be something that is more detrimental if you overdo it. But I would definitely certainly add in more muscle, because muscle is going to burn fat a lot faster. So when you do that, people will notice that they will lose some of the fat faster. And this is going to be something where you call like, okay, I lost all this weight on the scale. Remember what you're losing, right? So there are also there are different machines and apparatuses you can use that actually can measure your skeletal muscle, your body fat too as well, amongst other things. You're already using something that's already looking at your VO2 max. So there are things out there that people can utilize that would be helpful.
so two questions. Number one, would you recommend, because we have a multi-gym in the garage, so I am lifting some weights as
Good.
well. Leg weights, So is that sufficient for a woman of my age, or do I need to be doing more of that?
I think when it comes to exercise, one of the things that I would do is variation. And then you can also vary the intensity of what you're doing. So that can make like a huge difference in terms of getting past plateaus, say, for instance.
Yeah.
And then number three, if it's affordable for the individual, even some private training, I think that's very helpful because look, at the end of the day, we do what we do and we go at our own pace and we try to make it comfortable. When you work with a personal trainer, sometimes it's a little uncomfortable. It pushes you past that. There are even machines that are out there now that will actually have personal training with the pulley systems. And they have the trainer in there. And I can tell you, I have one at home. And I have multiple ways of trying to exercise I have at home. It's a lot more intense like when you do it with them because you're not stopping and you keep making you can stop if you really wanted to, you're out of breath, but it just keeps going and it's fairly nonstop. And when you go at that kind of pace, so you're tired by the end of that and you know you've been burned something really at the end of the day. And so I think having that variation with what you're doing can certainly be helpful.
No, that's great. Great tips. So, my second question was going to be around. So, I am really into stats. I use an app called Weltery that measures my stress. I use all the standard stats on my Apple Health app. So, for example, I looked at my husband last night, which links back to a point I want to dig into a bit more. And I said, how did you sleep last night? And he said, not very well. And I said, I know, because you were snoring.
Mhm.
and and I didn't get very much sleep either. You were so first question is, what measurements would you say are key for people to take? What would you say is good for us to monitor?
Now, as you mentioned, there are so many things that will measure so many different parameters. And I would say if I tried to, a simple thing, some simple things that one could do is, for instance, being able to know what your skeletal muscle mass and your body fat is. And I'm not that I'm promoting a device or anything, but there's one device called Hume, for instance, which is a little bit more economical to figure things out versus something like InBody.
Yeah.
That would certainly be helpful. People use things to see how many steps they take. I think at a very basic level, I think that's good because I feel like it's positive reinforcement to keep doing it, especially if you're starting to see some results for people who are not, then they feel a bit frustrated. So I think those are some simple things too as well. I think another good thing, which I think is helpful, especially from my point of view, is like heart rate variability. There are some apps that will look at that. How is your heart rate when you're doing nothing to when you're exercising and all of that, and quiescence and all that. So we look at like how the nervous system is responding to all of this. And we look at like different parameters for something like that. But also if there's really decreased heart rate variability at the end of the day, then more apt to have more medical issues and bigger problems down the road.
So for those, I am not fully familiar with HRV. I understand a tiny bit. Can you expand on what that is and what people should look for?
Yeah, so I try to just give it as basic as we can. Again, this is a little bit more of a complex parameter that I'll look at. But your heart rate variability, so when you're exercising and when you're sitting quiescent, your heart rates are going to be at different rates, right? If you're exercising, maybe your heart rate, depending on your age, say for example, is like 150 when you're exercising. Or when you're sitting down, maybe your heart rate's 75 or whatnot. And so there's a wide range so that your body, your arteries, your heart, they're all responding to what you're doing ultimately. But if you're doing different activities and exercise, you're sitting down and there's more of a narrowed range ultimately. That means the nervous system that's also affecting your heart, your arteries, and all that may not be working quite so well. And it's a sign what we call an autonomic dysfunction. What that means in English is that the nervous system is a bit out of whack. And when it's out of whack, there's increased risk of having issues with your heart. People can complain of things like dizziness, lightheadedness, brain fog, increased migraines, increased fatigue, to name a few, or
Yeah.
whatnot. And we try to look at these things in people too as well to make sure that they are genuinely healthy. There are some apps that do that. There are some devices that are more robust that do that too as well. But it's a little bit more of a complex parameter to look at.
Is there an app that you would recommend?
Not a great app that I can know off the top of my head. Can always get back to you on that one. But in the past, we've done things using a device called ANSAR testing, ANSAR. I don't know if that's available where you guys are at,
Yeah.
but that's a device where we look at like heart rate variability, see how your heart's responding to certain maneuvers and blood pressure changes and whatnot. But that's a device that's used to look at those things.
This is so fascinating. What you mentioned earlier about sleep apnea and how that can impact on things like heart attacks and strokes, and tell me a little bit more about it.
The best way to explain what sleep apnea is to somebody who doesn't know what that is, I give the analogy, if it may or may not apply to certain, but I give the analogy of you remember if you have kids or you remember when you were a kid and you were drinking out of those little juice boxes. In the US, there was something called Capri Sun back in the day. It was just a bag of fluid that full of sugar. Anyway, you drink out of that, you drink with a straw, and then when you get closer towards the end, there's so much negative pressure, the bag or the box collapses like that, right? And so with sleep apnea, that's what's happening when you're breathing at nighttime. So the airway constantly collapse. And so you're decreasing oxygen to your brain, to your heart, and the rest of your body. Also, what happens is that at nighttime, your blood pressure and your heart rate naturally will drop. If you have this, they're not dropping a whole lot. They may go up higher. So that's one of the reasons why people have increased risk of stroke and heart attack, amongst other things. It's also even been linked to cognitive issues because you're nearly not getting enough oxygen to your brain, essentially, and you're getting very poor sleep, so you're not consolidating any of your sleep as well, so the memory is going to be quite poor.
So, a clue for sleep apnea, other than maybe your partner noticing something, would be that the heart rate goes up higher. Is that the heart
Yeah, so
rate?
you would notice the heart rate stays high, it doesn't dip down, blood pressure
Right.
stays, it doesn't dip down. Just some common symptoms, even if you didn't have an app, would be how do you feel like in the morning? You feel tired and you feel exhausted? Is your mouth or throat dry? Are you running to the bathroom frequently at night? Do you have any reflux at night? These are common questions that we will ask people.
And all of that can be a sign of sleep apnea. Gosh. And how is going to the bathroom a lot at night related to sleep apnea?
You're affecting your whole body, your bladder, your whole nervous system with all of this. Just naturally, we'll use the bathroom a lot.
Yeah.
Also, on the flip side, and I thought about it years ago, is that you're waking yourself up a little bit more free. You're not getting deep sleep. And so if that bladder is also a little bit more full from whatever you consumed, you're more likely to use the bathroom anyway.
Okay. And what what are the solutions, the practical solutions for sleep apnea? I see all sorts of gadgets on Instagram. Is there anything, how do you approach or deal with your clients that have sleep apnea issues?
Yeah, so Matt, I don't use all the gadgets that are out there or anything like that because I think things are a bit left unproven, at least in my eyes.
Yeah.
I always would like to see look at the data and the research on those devices, but there's a million of them out there, and the market seems to be a bit flooded now with that. We do things at least that have been studied and researched more long term. So depending on the severity of one's sleep apnea, it may require something called CPAP or AutoPAP. What that means to the audience, that's a fancy word for a box that blows air into you, that keeps your airway open. Remember the analogy I gave you a little while ago? AutoPAP actually adjusts your breathing. CPAP is actually more of a continuous pressure where it's titrated in a lab setting. If it's mild sleep apnea, there's something called an oral appliance. For those of us who remember having braces and then retainers afterwards, it's a glorified retainer that kind of pushes your jaw forward to open up the airway. For some people, it might be a bit more positional, so sometimes body pillows or wedge pillows can be helpful too. People have heard of surgeries. One is called the UPPP. I never send people for this because they're basically trying to chop things in the back of your throat. It doesn't change the airway dynamic because it's still compressing. It just removes a little bit of the blockage. And now there are
Mm.
devices that will implanted that will actually stimulate your tongue from falling backward. Um, it's a surgical procedure,
Yeah.
hard sell for a lot of people for
Mm.
that. So there's still the classic ways of treating are still seem to be the best in my eyes. If eventually there's something that's better, that it's less cumbersome for somebody, I'm all for that.
Yeah, that's great. So can we now, you're a best-selling author. And your book is called Getting to Pain Free. I was saying I've just ordered it. It sounds fantastic. Tell me a bit about your book and then also about your journey to being pain free. What's your story?
So the book that, as I mentioned before we started, it was during the pandemic, so I had time to write, thankfully. Hard to do that nowadays. But it chronicled my journey through everything that I had been through. So one of the things I also focus on in my practice is regenerative medicine. And what that really means is we try to help people with chronic injuries and pain that are not being solved by drugs or surgery or through the traditional whatever insurance covers. I'll take that kind of thing because those things always don't work. And try to give you a quicker version of this, but probably trying to think how many years back, 14, 15 years ago, something like that. I had injured my shoulder lifting some weights, and my joint in front of my shoulder was hurting a lot. And it was miserable because I couldn't lift weights. I couldn't lift my arm above my head. It was hard to put on a jacket. I went to the orthopedic doctor, and the orthopedic doctor, one of the first things he said was, you know what? Maybe you just need to have a surgery. Maybe you have something called a slap tear. That's medical jargon for cartilage tear in the shoulder. And not exactly the thing I wanted to hear since I already had a failed knee surgery, which I can get into a little bit more later. And did the MRI, no tears, no nothing like that, but there's still arthritis in the joint. So his physician assistant just blindly injected some steroids into the joint. Later on, when I looked at it on ultrasound, it looked like a dog had chewed on the bone. And he was telling me basically, look, you're not getting any better, or tried all the conservative approaches. So what you might need to do is just chop off part of the bone so there's no pressure on the tendon or anything like that. Wasn't exactly very appealing to me since I have gone through surgeries in the past. At the same time, I was also having a lot of foot and ankle issues. Did training in New York City, so I'd walked a lot prior to all this. And one day when I was walking, going to work, I felt some pain in my foot, and I thought it was the shoe. And turns out it wasn't the shoe because even when I changed it, it didn't go make the pain go away. I went to the foot doctor, and the foot doctor essentially told me, you know what, let's get some orthotics for you. They didn't work. Did a couple of steroid injections, wasn't working. But by the third time, I actually started feeling better. So I was like, okay, fantastic. Steroids are great because they make you feel better. Or so at least so I thought. And so I started running on the treadmill, and then I injured my Achilles, which is the tissue on the back of your heel. Quite painful. I was limping around, my shoulder was hurting, and because of all of this, the dynamics of how I was walking also started changing. So I mentioned that failed knee surgery. I had an ACL repair back in 2001. My knee started hurting again. Lo and behold, when I repeated the MRI, it showed that the ACL that was theoretically repaired, well, wasn't really repaired very well. It was a failed surgery. Probably wasn't put in very well from talking to some of my colleagues. So I had all these things. They're telling me take some pain medications or do surgery. Went to an orthopedic doctor for the knee, and he just wanted to scope my knee. I have no idea. Maybe he said, we'll just clean out stuff. Like, you don't even have an MRI to even look at. And so I had to find a different alternative solution. So I learned about something called prolotherapy. And so prolotherapy is just a way of causing a little bit of controlled inflammation in the body where you're stimulating cells to try to help heal the area. I started learning about platelet-rich plasma too as well. We went through trainings, had treatments. But to make a long story short, through all of this, I had to do several rounds of PRP into my joint over here to help overcome that to undo the steroids. I had a couple of rounds of PRP also into my foot to do the same thing. And my Achilles, because it was so badly injured, I had to do at least 6 or 7 rounds of treatments on that to help get that better. And now at least I'm at to the point where I can run. It doesn't physically limit me with anything like that. The failed surgery, it is what it is. I don't have an ACL, but I have a bunch of scar tissue that kind of pseudo holds things together. We've introduced things like autologous stem cells, meaning stem cells that come from you, try to help heal tissues too as well. So I'm holding out for maybe something one day can be developed where you're actually just injecting something into the knee. It is modified to go where it's supposed to go to help repair and heal that. When that will happen, I don't know, but I know I don't want to go through another knee surgery because that's going to lead to increased arthritis, which there already is because of the initial surgery to begin
Right.
with, and then as you age too as well. And so I implemented this probably 13, 14 years ago in the practice, and we've been doing it ever since, and it's helped a lot of people stay away from surgery. Been able to do it on my own family members too as well, and preventing them from having to go undergo the knife too as well. And so for us, it's been very helpful. The book chronicles a lot of this, goes also a little bit into like diet, mindset too as well. So shows people that there are other possibilities out there and there's a way to get better.
So this is fascinating, and I want to dive into what your average day is like and how that works. Before we go there, what's your view on the emotional pain? So to give you an example, so many years ago, I tripped up the steps leading to our house. I had silly shoes on. I fractured my knee. I didn't
Hmm.
know I'd fractured my knee. I did the
Right.
usual.
Mhm.
I stuck some steri slip strips on it and I hobbled around for 6 weeks. I went to my doctor and he said, "Why didn't you come sooner? I suspect you fractured your knee." They sent me off for some physiotherapy, and the physiotherapist said to me, "I can give you some exercises, but you're not going to get any better." I couldn't do yoga, I couldn't run, I couldn't put any pressure on my knee. And the area of work I work in is I heal trauma using a technique called havening. It's
Mhm.
designed by a doctor of neuroscience, a guy called Dr. Ron Rudin. And so I thought, okay, in that moment when I hurt my knee, it was close to childbirth pain. It was that painful.
Right.
And what I noticed so there was an emotional component as well. So I physically hurt myself, and there was an emotional component.
Mhm.
That emotional component was re-triggered every time my massive donkey-like dog ran towards me because I was afraid he was going to hit my knee. So it was triggered then, and it was also triggered when I got in the car because I kept catching it on the dashboard when I got in the car. Long story short, I thought, what have I got to lose? I'll try havening away the event where I injured my knee, and it healed. And I can kneel on it, I can run on it, and I can do yoga. I've since looked into it further, and there's a book called I Can Heal Your Back Pain by, I think he's called John Cesarano. I think he's no longer with us anymore. But it was to do with there's this emotional pain connection with how we experience pain. So, can we get into how you deal with pain for people? You've spoken about prolotherapy, you've mentioned mindset. I'm interested in all of that. Tell us more.
There's no doubt that what we think about can affect our body. And so, yeah, there is the trauma of the event that can occur with any like acute injury, say, for instance. But then there's also feeling worn down from chronic injuries, even though they started out smoldering with all of that. And so I think for us to approach that, one of the things we always say is instead of accepting it that this is how it's going to be, how can we really try to improve things? What steps can we take? How can we think about this and view it a little bit differently? Going even from the Tony Robbins mindset, we look at like depression and anxiety. It's because our mind is on overdrive and thinking the same negative things over and over again. It's a natural inclination to do that. For thinking about it in the other way, where things are positive, so it's hard for people, right? It's really hard and challenging. And it's because we're not conditioned that way. And so we try to help people think about it in that regard and try to give them maybe some things that would be helpful in times of that. The other thing I also look at is things like gratitude. What are we grateful for? Common thing, probably hear a lot on, at least now social media, it's a lot more than what it used to be. But back then, when I brought up in my book, I don't think anybody knew what that was. No, we really knew what that was talking about, maybe not a whole lot. But it's that training, we're like, okay, well, what was good about today? Don't focus on whatever negative or happened today. Don't focus on how bad maybe you were treated that day or how bad that thing was hurting you. What's one thing that's positive? Because if you keep doing that over and over again, your body's going to accept more of that positive emotion. And then what you're feeling, not to take away anything from what one's feeling, is going to feel less overall. And they're going to be able to deal with it better. But then by feeling less in your mind, you're more likely to take more positive steps, even on the physical approaches of trying to help overcome that too as well. And so I think that's really important for a lot of people.
So, when you say feeling less in the mind, is this also feeling less pain in the body as well? So,
is
Yeah,
that connection too.
yes,
I did hypnobirthing, for example,
right.
for 24 hours.
Uh,
I won't go into that story, but it's great to have a doctor on. So I promote gratitude as well, and the science shows this isn't the science behind gratitude, but it's the science behind optimism, that we live 19% longer when we're optimists. And then there's whole is it Joe Dispenza, Dr. Joe Dispenza, who has also done the studies on gratitude and how we then start to help our bodies as well. So there's loads of stuff out there. So it's great that you're saying that as well, because they'll be used to me saying it, but the fact we've got a doctor on saying it, that's really cool.
yeah.
So now just talk to me about what are the strategies you use with your clients or recommend when clients are thinking things over and over in a negative way. How do you stop that with them, or what do you recommend?
It's a little bit of a complex answer, but I'll try to boil it down to something that's simplistic. It's taking what is the recurrent negative thought that is constantly happening. And you'll hear it from patients over and over again because they keep going back to the same point over and over and over and over again. And so one of the things I try to do is a bit of a pattern interrupt. So while they're in that circular loop, there are things I may say or things I may do to help redirect it a little bit, reshift, and then to try to come back to that and then try to go over something that would be more of a positive anchor with that to help undo some of it. It doesn't mean that I'm a psychologist, psychiatrist doing it, but I'm trying to break them out of that loop a little bit. And so I try to work on that sometimes with folks too as well to help them break out of that loop. It's quite challenging to do that with people who have been anchored in for so long. I think also, hey, there's a lot of Tony Robbins apps that are out there too as well, and information online. It's great. So a lot of that stuff is free too. There's no harm in looking at any of that stuff because I think that's ultimately helpful for somebody who just really feels like they need something structured. We always have the last resort option of, hey, let's maybe get you over to a psychologist to start working on things, even though sometimes working with a psychologist might take a bit longer to work through everything. It also depends on what the person's expertise is.
Yeah.
But that's just a very small snippet of how we try to go through that.
So that was all NLP language, was it? Neuro linguistic programming. So pattern interrupt, positive anchors, redirection.
Mm.
So I understand that because I'm an NLP trainer. What, from a practical point of view, so what would that look like if you were talking to a client? So if you were doing a pattern interrupt and trying to redirect their thinking and then to create this alternative positive anchor, what would
So let
that
me just
be
give you an
like?
example. If you've ever seen some of the Tony Robbins stuff when he's done this, and sometimes you're shocked at what he says or what he does, and everybody's, what is wrong with this guy kind of thing. I don't quite go to that degree or whatnot, but I always say something silly or something that may I'm just trying to be as polite as I can, but something that may rub them the wrong way a little bit with all of that. And then once I got them, and now all of a sudden they're thinking about it and they're out of that loop, then I'll try to jump in and go back to some of that gratitude and all of that, and some things that they found that was positive in their life, or something they did that actually gave them momentum to improve something or whatnot. I try to get into that a little bit and then try to put that in. And then each time they come with that pattern interrupt, add that back in there to help break it. And then sometimes, I mean, there are other ways of doing it too. So again, this is all the stuff I do, and it's more stuff like you would be doing, for instance, or whatnot. But even then, they're like physical things that you can do. So for one of those things, even then, if you listen to any Tony Robbins stuff, if you think like a negative thought, he makes you do this kind of thing, or snort or something like that. It's like a wah wah,
Yeah,
like that kind of stuff.
that is great.
Literally. Sometimes that's what's required to help people break through that.
Yeah, so it's interesting doing something silly or rub them the wrong way. So so when I studied NLP, it was the provocative side of coaching. And so when someone says, I can't possibly do whatever it is that they were trying to do, and so you might provoke them by saying, really? You can't even do that? Or so it's that type of thing. And then going back to what you were saying about gratitude. So take, for example, my daughter's 17. I think teenage years can be challenging. They're studying. There's a lot of anxiety out there, I think, for this generation. And so tonight, her form of gratitude, we live at the top of a big hill. And I said, how was your day? And she said, Mum, I've just been and taken pictures of the sunset. And it really made me feel grateful. And she showed me the pictures and she said it just put everything in perspective. So it's just having those little moments, isn't it? So to start bringing things to a close, there's so much information in there. First of all, tell us about the program that you've got coming up. You said you were launching it in 2026.
Yeah, so there's a memory course called Reclaim Your Mind. And the basic premise behind all of this is to see that there are things that we may have under our control that can help us improve our mind, our memory. Because most people come in and they have memory issues, everybody thinks they have Alzheimer's. So we're trying to show that, hey, look, if we can try to get to things earlier, we could help try to work on improving our minds and not getting lost in the negative thought loop of a 40-year-old has Alzheimer's when they come in, because we see people like that, quite honestly.
What, that they're fearful that they've got
They're
Alzheimer's?
they fearful that they have it now. So we look at a lot of different parameters and things people can look at, start thinking about, ask their doctors, maybe some other testing that may be done to look at things. And so we break that down in that course. So we're launching that hopefully January 2026. It's called Reclaim Your Mind, and we'll share that information once we got the links up and running.
No, that's great. So I will share a link to that in the show notes for those of you that are interested. So if you were to recommend 3 things that would really help people with their health to lead their best healthy life, what would you say? What would you recommend are the top 3 things?
The most basic things you can think of. Be grateful for the things that we have. Focus on those. Exercise. Keep yourself fit. That's going to help with your body ultimately too as well. Be mindful of what you eat because food also can cause you harm.
Yes, that was one of the ways in which I recovered from ME was, so I'd learned about inflammation. We didn't call it inflammaging, but it was just inflammation. And in order to recover, I had to work out which foods were causing inflammation in me. So causing things like heartburn, migraine, fatigue as well. So I kept a food diary, I got tested, and that led to a quicker recovery and regaining energy. So what are some quick tips you can give around what you should eat?
This would be very generic,
Yes.
ultimately, but I would focus on proteins, grass-fed proteins in general, and I would also focus on high-quality vegetables
And
and
what do you mean by high quality vegetables?
organic, as if at all possible. Doesn't mean that's 100%. There's chemicals and things in the ground, which I'm not even going to get into now, but I think that also helps with the gut microbiome and all that helps with a lot of issues ultimately. Protein, I think, is also really important to make sure we maintain muscle too, and to also avoid a lot of processed foods that we normally see out there. It's a lot of stuff that comes in boxes.
Yeah. Okay. Food that's been messed around with. So I have a question from our last guest, who was also an author. And also, if I could ask for you to leave a question for our next guest. So this question is from Deborah Lyon. And she said, if you had to give a piece of advice to your 18-year-old self, what would it be?
Don't give up. Keep going, no matter how hard things get.
And how do you keep going?
Gratitude.
Yeah. And what question would you like to give or leave for the next guest?
Without knowing who it is or what they do or whatnot, I would
Yeah.
say, what steps can you take to lead your best life?
Ooh, nice. So thank you so much, Dr. Mian. It's been great having you here on the podcast, full of so many useful tips from start to finish, to be honest. It's been absolutely fascinating. Thank you so much for coming on.
Yeah, thanks so much for having me. I really appreciate it.
No, you're welcome.
If you'd like to be notified when the next episode drops, remember to subscribe. If you found this episode helpful, please share it with someone who might benefit. Finally, if any of these topics have sparked your interest and you'd like to work with me, you can apply for a free discovery call at estellereed.com. Let's see if we're a good fit. You'll also find plenty of free resources there. I'm Estelle Reed, executive coach, speaker, and best-selling author, and this has been the Optimising Your Brilliance podcast. Thanks for listening. This podcast is for informational purposes only and should not be considered professional advice. Please consult with a qualified professional for any specific advice related to your situation.